Hey everyone, welcome back to the Founder Series, where we talk about the business of medicine, the biology of midlife, and how to build a life and body that carry you into your next decades with confidence. I'm Dr. Rebecca Hurdle. I'm a board certified osteopathic family medicine physician, a certified menopause practitioner, and founder of Osteopathic Midlife Health, where we care for patients virtually across multiple states. I'm Dr. Hurdle, and I'm genuinely excited for today's conversation. My guest is a board certified women's health physical therapist, a practice owner, and the founder of two organizations that are changing how pelvic health is delivered and supported in this country. Before I introduce her to say hi, let me tell you just a little bit about who she is. So Dr. Amanda is a board certified women's health physical therapist, business owner, and a founder of Root and Rise Consulting and Unbound Pelvis. She began her career in sports medicine as an athletic trainer before earning her doctorate of physical therapy and completing an orthopedic residency. She practiced in orthopedics for a decade before transitioning her focus fully into pelvic health, where her work integrates biomechanics, pelvic health, and a nervous system informed approach to support women across the lifespan. Her path was deeply personal after navigating pelvic pain, two cesarean births, and the experience of being dismissed with a fragmented healthcare system. She recognized profound gaps in care, and this led her to pursue advanced training in obstetric and pelvic health and to build a clinical approach rooted not only in biomechanics and safety, but in lived experience and whole person healing. In addition to over 15 years of clinical practice and leadership, Dr. Amanda now channels much of her energy through Root and Rise Consulting, helping pelvic health visionaries move from overwhelmed to aligned, building sustainable practices with clear strategy, streamlined operations, and financial clarity. Her work is particularly focused on helping individuals who have been told their symptoms are normal or unresolvable finally find answers and a path forward. Thanks for coming.
Thanks for
That's
having me.
amazing. Yeah, this is awesome. What a story, athletic trainer to DPT to orthopedic residency to public health specialist to business owner now to like consulting. And so, that's definitely not a straight line. Was there a moment where it all started to feel like it was connecting, or did it feel like a series of pivots at one time?
Like looking back, looking back at my own journey, right? It feels like one thing led to the next, you know?
Yeah.
So, but all based in like just life and lived experience and how that sort of, would transition me from this place to this place. And so I think there are some like pivotal moments though, like some
Mhm.
big like turning points and in my career. So particularly when I had my children.
Well, tell us
But
about that.
like, as I went into the pelvic health space and started to learn more things, so many other things that had happened in my past sort of like just started to make sense. Do you know what I mean?
Yeah.
And how they like sort of all interacted with one another. So there's a big through line, but it's sometimes you just don't know what you don't know, right? And when women and women's health is, not researched and a lot of people don't, there's just so many underdiagnosed conditions
Yeah.
and just lack of research and lack of education and awareness. I mean, the list goes on and on and on. So, it sort of makes this recipe for a lot of people to have things happening to them that they just get dismissed and they don't really know what's going on, or they end up with, a slew of providers and
Yeah.
still with symptoms.
Large gap, right? Large gaps in care, large gaps in training, large gaps in research. That's like there's just large gaps,
Everywhere.
Right. So, kind of take us from the beginning. How did the physical therapy, how did you know that that's what you wanted to do? And then just kind of take us along that journey a little bit.
Yeah, I mean, so I was highly athletic, when I was a teenager. Um, it's kind of funny. I was a gymnast for many years, and then I got into like competitive cheerleading. And I sort of jokingly say, like, well, yeah. And then I just like ran cross country for the fun of it on the side because
Yeah.
that's what people do. So, highly active, young female, and didn't really have normal periods until I was in my early 20s, right? And really, the only reason I had normal periods at that point was because I was put on birth control because I wasn't
Mhm.
having normal periods. So, looking back, right, like look at my journey and I'm like, okay, very athletic, very busy, moving around all the time. And or definitely like a relative energy deficiency in sport situation, right? Right. So then got put on birth control because I wasn't having my periods regularly. And, and it kind of was like this battle with birth control because it was sort of like, okay, and I also had like really bad PMS symptoms and stuff as well. So it was like
Yeah.
this battle with birth control because it was like, okay, this helps. This makes me feel better, right?
Yep. Yep.
Pretty significantly, 75%. Not all the way there, 75%
Yeah.
better. But then you also like have side effects from the birth control too. And so
Yep.
for me in particular, like some of the things that I noticed like pretty quickly being on it was like vaginal dryness and even just like a change in like libido and that kind of
Yep.
thing, right?
Yep.
Um, and so I would go off of birth control and then I'd be like, we're going to conquer this. We're going to figure this out. Right. And then I would end up with a provider. And it was like the same story over and over again. Right. Like, so we take labs are all normal, da 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 da. Like, this is just the way that it is. Like, and then, I would just end up on birth control because like the benefits I was getting outweighed the
Right.
side effects that I was
Right.
having from it. Right. And then probably when I was like 29 or 30, I started having intermittent pain with penetration and I was starting to have like cyclical night sweats during my luteal phase, like a little bit of brain fog that started to kind of like creep in intermittently as well. And, just like looking back at that point, because like I had my first son when I was 31. And that was like prior to that point, I'd only been in like orthopedics and sports medicine as a clinician.
Okay.
And
So
so
the
I
whole
didn't really,
time, yeah.
yeah.
So like the whole, what, 10 years, or when did you graduate and then start into practice? Was it like an employed practice? Is what
So
you?
I started, let's see, I graduated from my athletic training when I was like 22, I want to say. And then I took a year off and then I
Uh-huh.
went to, well, I kind of was like forced to take a year off because I didn't get into PT school the first
Yeah.
year.
Hey,
And so I
we've
took a
all
year
been there.
off and I worked and then went back to PT school. And so I was
Mhm.
26 when I finished
Okay.
PT school, right? So I'd kind of
Yeah.
been in athletic training, sports medicine,
Yep.
orthopedics. And when I graduated from PT school, I started working in like a hospital based
Yeah.
system, but like outpatient
Yep.
department. And then right around the time that I graduated was when I met my husband. And then for his work, that took us to the Washington, D.C. area where we spent a
Okay.
decade. And
Okay.
so when I was in the DC area, I started working for like a private practice. So outpatient, orthopedics, private practice. That's where I did my orthopedic residency. And so I finished up my orthopedic residency. And I think I was very early pregnant. So within the first, I don't know, probably 8 weeks or so. I don't know. And so I finished up my orthopedic residency and sat for my boards in March. I was probably about 20 weeks pregnant at that point, and then found out I had passed everything in June and had my son on July 2nd. So yeah, up until that point, I was just sports medicine,
Yeah.
orthopedics.
Which seems like the typical, like, athlete that wants to do, right? Like, when I hear women who are athletes, they are something, either ortho or sports med or physical therapy. For ortho, they wanna take care of female athletes and things like that.
Yeah. Yeah, and all that other stuff was, like, happening behind the scenes, right?
Yeah.
Where you're just like, "Okay, I'm having all of these, like, period issues," and kept going to this provider and then hearing the same thing, and then going to that provider and hearing the same thing, right? And so, yeah, it was, like, it was frustrating to say the least,
Yeah.
because you sort of, like, have this point where you're like, "I know something's not right," like, you could feel it, right? But then you keep going to, to try to figure it out. And it's
Yeah.
just, I just basically ended up back on birth control.
Right. Because and they didn't know the difference, and I
Yeah.
think that even some practitioners now still don't know the difference between, like, why that happens. Like, why when you put someone on birth control, can they have those types of symptoms? Can they have those side effects? Can they have, and really we should be talking about that, right? That it may decrease your libido, it may give you vaginal dryness because it's not the same, you're shutting your ovaries down and you're not hitting those same receptors with that type
Right.
of estrogen, right?
Right.
It's the craziest thing.
I
And
kind
so
of think back on it too, and I'm like, okay, I'm so glad that I didn't have problems getting pregnant. So when I
yeah,
went off birth control, I didn't have problems getting pregnant. Did have a miscarriage in between my two
mhm,
boys. But that was the one isolated incident. Yeah, so up until that point, like when I had my son, I was 31 and
mhm.
everything had been like orthopedics and
That's what yeah,
sports medicine. Yeah.
that was like, no, you didn't even think about anything else.
No, I mean, it's kind of funny because, like, I graduated from PT school in 2010, right?
Yeah,
And we had a pelvic health physical therapist come and talk to us for 1 hour in the 3 years we were in school, and interestingly, on that day, I had a doctor's appointment, so I wasn't even there for the 1 hour, lecture
right.
on it.
That's like our menopause care. It's like our menopause lectures. One
Yeah.
lecture, although I'm like, I don't even think I remember that one. I don't even think we had a lecture, quite honestly, about
Well, I
perimenopause.
didn't I didn't I was and I feel like they did biofeedback too, so, like, one of the girls in our class, like, volunteered to, like, insert the probe, and they,
Yeah,
like, did some biofeedback, is kind of, like, one of the things that they had done during that lecture, but it was very, very minimal, right? So, like, this is just, like, not even on my radar at all, right? And so then I got pregnant, had my first son, and, I had a pretty uneventful pregnancy, I would say. Um, Maybe up until towards the end, because I had premature rupture of membranes when I was about in my 36th week. I would bet money that I was carrying extra fluid because somewhere in like the 28th week, like I gained like 6 to 8 pounds out of nowhere. When I went to the OB that week, she commented on it.
yeah.
She told me I should maybe, like, pick some apples to eat instead of and I was, like, really coincides with, like, a lot of increase in swelling
Oh, yeah.
as well, and then probably I think I was, like, around the 30th week, I started to, looking back on it, like, maybe I actually was dribbling, like, amniotic fluid
Yeah.
because I just had, like, a lot of pressure, and I would dribble when I would, like, bend
Yep.
over and, like, move around, and then in the 36th week, I had premature rupture of membranes, and I remember, like, talking to the OB when I was at the appointment, because at that point I was going weekly, and the appointment right before, my water had broke, and was talking about how uncomfortable I was, like, being at work and standing and walking and, like,
Yeah.
all the pressure, et cetera, et cetera, et cetera, and, she was like, "Well, when I was 40 weeks pregnant, like, I was, like, in early labor doing a C-section." And
Right. What
I was
is
like, "I
that?
actually don't even care that."
Right. Like, we're not even talking about you. What does
Right.
that mean? But that is I hear those stories all the time from especially, other like clinicians like that. Like, well, I worked up until like the last day and I was still working out. And yeah, I was doing C-sections and I was in surgery. So we're like shaming other women who are
Yeah,
coming to you, right?
yeah.
For like something that's going on that's not normal for them.
Mhm.
And then you shame them for that. It's so
Instead of, like, looking at it and
unacceptable.
being like, "Oh, that's interesting you gained weight," like,
Right.
maybe, like, let me investigate that a little bit
Yeah.
more,
But
or,
don't
like
yep, yep.
yeah,
And don't
it
you
was
think
just
though
like
that that is part of the, like, you don't who has time for that, right? Like, that is the problem.
well, yeah, and this was, like, a traditional, like, healthcare outpatient setting. We cycled through the OBs because
Mhm.
they had, like, a kind of like a
Yep.
call schedule, so you got to
That's
meet
right.
all the OBs because you didn't know
Yep.
who was gonna be on call when
That's
you
right.
went into labor, you know?
Yeah, it could have been
Um
anybody.
And I was at work, I bent over to pick something up, and my
That
water
was it.
broke, and I was like, "Wait a second, I have, like, a month, what's happening here?" You
Yeah.
know?
It's really
Um,
scary.
so
Really
ended up
scary.
and, I mean, luckily, nothing really it was just, like, I was just, like I
Yeah.
didn't start really having contractions, I didn't really go into labor, we ended up, like, slowly
You
making
just
our way to the hospital, and then I ended up getting induced with Pitocin because I wasn't going into labor,
yeah.
and, it was just kind of that whole rigmarole and, ended up with fetal decels in the 60s, and next thing you know, I was having a C-section,
Yeah.
in the middle of the night. So, yeah, so I remember, like, going in so, I mean, kind of like, go back to, like, my orthopedic working as a orthopedic physical therapist, sports medicine. I remember this story all the time where a lot of women would come in, and they would be coming in for, like, back pain or pelvic pain or SI pain or something along those lines, or hip pain, and it was just this, like, common story of, like, "Well, this started when I was pregnant,"
Yeah.
you know, and it went away and then came back with my second, and then, and then here we are 15 years later still with, like, chronic pain, right?
Yep.
So, I
Yep.
remember this story through my patients, through, like, my clinical experience, and then I, went through a pregnancy and then had a, C-section, so a major abdominal surgery,
Yep.
and I, like, came out the other side, and I was, like, 2 weeks post partum and went into my first, like, follow-up appointment, and I was like, "So, can you explain to me why you don't send everyone to physical therapy? Because the amount of change that my body has gone through in the last,
Yes.
year and
The whole
change."
pelvic change, let alone the
Right.
low back.
Yeah, and she looked at me, she's like, "Well, we do, but, like, in rare cases." And I was like, "No,
Everyone.
I think we're, like, missing the boat here,"
Yeah.
right? And I think
Yes.
that was, like, the moment for me where I was like, "Wait a second, we can do better," you
Yeah.
know? And
That was your
so
aha moment,
that
was
was, like,
that
my
after
yeah,
that C-section
yeah,
and kind of feeling dismissed by, that whole system you were pretty much trained in, right?
yeah, yeah.
And so
Yeah, so then, like, 10 so when I was, like, 10
yeah,
months
it was
postpartum, I took my first, like, pelvic P so
awesome.
as a physical therapist, you come out as a generalist, and then you can make the choice or decision to
Yep.
kind of go get advanced training, right? So that's what the orthopedic residency program was that I did, and then when I was 10 months postpartum with my first, I started taking, series in pelvic floor. So pelvic
Yeah.
health, pelvic floor, obstetrics, between 2016 and 2020, I took probably 1, 2, 3, 4, 5, 6, 7. I think it was like 8 or 9 courses. So there was a series of 3 pelvic courses, a series of 3 obstetrical courses. I did do a menopause course as well,
Yeah.
perimenopause, menopause course. And then I sat for my BCS in 2020 right before, like, the world shut down with COVID. So, I was glad to get that done
Yeah.
before we kind of went on lockdown. But all of that training was, like, above and beyond,
Yeah.
PT school, residency, etcetera.
Yep, and all on your arms, right? That's I think it's the same for us, like, you come out or at least for me for family medicine training, you come out like a family med general, and then if there's anything that you wanna niche yourself into more, that's all on you to do,
Right.
you know?
Right.
Yeah.
Yeah, and then when you as a PT, like, when we show up for these courses, you meet a friend, you're like, "Hi, I'm Amanda, you wanna be my partner?" And,
Yeah.
like, you strip down during the
Yeah.
labs
So,
and,
yeah, so
like,
you were like, "This is, like, real deal, we're getting
you,
personally
like, get
knowing
all the
somebody."
pelvic exams, the rectal
Yep.
exams, and so that's just how we learn.
How you learn, you have to do it. You have to
Yeah.
do it.
So I've had a few pelvic exams my day here, but
Yeah. And then that was it. You were just like, "This is what I was meant to do. Like, this was my calling."
yeah, I
At
just feel
least
like something kind of clicked for me, and
yeah,
I was so lucky being in the DC area, and there was a DMV Facebook group that had got started at some point, and then
yeah,
through that group, I found it and joined, and then I was able to connect with a lot of other providers in the local DC area, and I think able to sort of, like, put this full picture together of
yep,
my past to current, at least as I knew it at that point in time.
yeah. And then so when you decided to fully transition into pelvic health, was it a clean break from ortho? I still think that you probably had some foundation intentionally from ortho into pelvic, or was it completely like, "This did not help me at all?"
Oh, no, the orthopedic knowledge is so
Yeah,
valuable.
yeah,
And in fact, like, I have a strong maybe a strong bias that people should have some orthopedic knowledge before you throw in the pelvic
yeah.
floor.
Tell me
because
why.
there's so
Tell us why
yeah, because
about that.
there's
Yeah. I mean, I get that as an osteopath. I mean, structure and function, you're
yeah,
talking my language, right?
yeah,
So,
yeah.
but yeah, kind of talk to us about that a little bit because I think, for people, we oftentimes, there's a lot of, when you look at a human body, and a lot of times we piece it instead of like everything functions together, right? Your ankle can affect your knee, but that can also affect your hip, that can affect your low back and, and all the things. And so, my training is the same way. Like everything works together well if everything is working together well.
Mhm. Yeah.
So tell us a little bit about that, like ortho. So, ortho and pelvic physical therapy, if you're like, you would say everyone needs to at least,
I mean, and everybody, you're going to become a general you're going to be a general PT, right? So you're going
yeah,
to get orthopedic knowledge in PT school, right? And there's a lot more clinicians are kind of going right into pelvic health because they now can sometimes do internships in that space, and they can
yeah.
even like take these courses at the courses that I took as students. So they can
Okay.
come out of school like going kind of right into the pelvic health, pelvic floor space. But I do think, yeah, like if you treat the pelvic floor in isolation, you're really like, you're probably gonna get some people better, but there's a lot of people that you're gonna stall out with because there's
Mhm.
just so much connection and influence on the whole kinetic chain.
Yeah.
Um, there I mean, and I think about this a lot too, because like there's like, for example, like a patient that's kind of coming to mind right now. She's like, yeah, like I started off with this like hip pain, right? So I went to the orthopedic therapist and I was
Yeah.
doing my therapy there, right? And like my hip pain was getting better, but then my leakage started getting worse, And so it's like, right? And
Good.
so now you go to the pelvic floor therapist, right? And maybe you get the leakage better, but like maybe the hip pain doesn't get better either.
Yeah.
Maybe it does, but maybe it doesn't, right? And so I just think and there's a lot of studies too that kind of go into like back pain, and 75% of women with low back pain that get screened for leakage or urinary urgency have urinary urge incontinence, and then vice versa. So if you go to pelvic floor therapy and you have urinary urge incontinence and you get screened for back pain, 75% of those individuals have
Mhm.
back pain. So it's like if you're treating the pelvic floor in isolation as this solo thing and you're not
Yeah.
really addressing the external influences, which includes the brain and the nervous system, and you're gonna stall. You're gonna potentially get into this situation where you're not quite getting to the root cause of things, and so you can get people feeling better, but sometimes we don't want band-aids, right? Like we want to
Yeah.
be able to kind of like get all the way down to the root. And there's just so much influence. I kind of have like a very special interest in the hip and the pelvic floor. Yeah, it's kind of like one of my loves.
That's really cool though. Tell me the correlation between that.
Um, yeah, I think I just with the hip and the hip rotators and how they go it. So like your two joint hip rotators, so your piriformis and your obturator
Yeah.
internus. So they sort of come in to the pelvis from the hip and they form the wall of the pelvis. Okay, at which your pelvic floor or your hammock hangs from one side of
Mhm.
the wall to the next, right? So I kind of will explain this as like you have your trees, right? Your obturator and your piriformis, and then you have your hammock hanging between the trees, right? And so if you have, you know, femoral acetabular impingement, you have labral tears, if you have hip dysplasia, which is much more common in women than
Yep.
men, um, and start to get dysfunction through that hip, and maybe you don't even have some of that pathology, you just have mechanics that put a lot of dysfunction through your rotators, where a lot of times we'll see a lot of emphasis on the external rotators and kind of using those deep hip muscles instead of like your actual glutes,
Mhm.
especially with the mechanics of how your body changes in pregnancy, and doesn't always get recovered and rehabilitated postpartum.
Almost never.
That
Yeah.
Yeah, and so that like, if you have dysfunctional hip muscles, then the wall, the foundation at which your pelvic floor functions off of is also not functioning well, right?
Yeah.
And so there's just like so much connection between the hip, the low back, like you said, the feet, the
Yep.
nervous system, the brain, the thoughts that we have, like, so yeah, I think that's where I'm a big advocate that, have a, and even when you look at like the women's health physical therapy exam that we take for our board certification, I think it's like 25, give or take, percent of that exam is orthopedic knowledge, right?
Okay. Yeah.
Yeah, so like a quarter of that exam is just on straight up orthopedics.
So that's important.
Um,
Yeah.
and you also
That
have the
makes sense.
principles like of
Makes sense.
strength training, and you
Yep.
have the principles of, because the pelvic floor is just a muscle,
Yeah.
right? So if you take that general physiology and a lot of the principles that you get in orthopedics and you can apply it to the pelvic floor, I think you also can really, just help to like train the pelvic floor in a way that it can meet the demands of your life.
And
Yeah.
learn how to do
So
it. Nobody knows, like, no one knows how to use their pelvic floor. I'm like a firm believer in that until you know how to use your pelvic floor, right?
yeah. Well, and it's like it's kind of like hidden and
Yeah, we just are not
nobody.
never taught how to, like, how to do it, how to use it when you're giving birth, trying to teach how to use that pelvic floor and to bear down, but in the right way. You can't, as they so often are, you like using their neck to push and,
It's a different biomechanical pattern that you're using to poop and to like
yep,
push a child out
yeah,
versus like the pattern that you should be using, from a strength stability standpoint
yeah,
as you like navigate your life. Just
right,
we get potty trained when we're little. We take on these patterns that we learned,
mhm,
from our parents, whether it's right or wrong, good or
right,
bad, right?
yeah,
And so, you know, and then that's what we carry on with, right? And then you don't really think about it until like dysfunction shows up. And sometimes that
yes.
happens before you have kids. Sometimes it doesn't, right? Even
No,
I,
it's
I mean, I
true.
can remember my son, like my 4 year old, when my son was 4 years old, he would I mean, the kid could hold his urine forever. And then he would wait too long and then he would end up
Yep,
having an accident, right? So
yeah,
they
yeah.
they were like, "Well, we're just gonna make him go to the bathroom every 30 minutes and try." And I was like, "No, no, you're not gonna do that. You should
Did you look
wait
at his
2
pelvic floor?
hours." What's that?
Did you look at his pelvic floor?
I didn't, but I just like I'm like, "He doesn't like, he can hold his bladder.
That's just
He
his
can hold
thing.
his bladder all night and wake up in the morning, and we had to
Right.
remind him to go to the
You just have
bathroom,
to, yes,
right?
yes.
So
No, it's true, like, think
he can
about that. You're not going every 30 minutes, are you?
yeah,
He just has
yeah,
to, like, remember the cue to be like, "Oh, yeah, when I have to go, I need to
yeah.
go," instead of waiting another 5 minutes to finish what I'm
Right. It's
doing.
probably like a typical little boy just like
So true.
playing and having fun. They're like,
Yes,
I don't want to
and
go
girls
shower.
too.
I don't want to brush my teeth. I don't
Yeah.
want to go to the
Yep, you got
bathroom.
it, and girls are the
Yeah.
same exact way. They don't wanna stop what the kids just don't wanna stop what they're doing, you
Right.
know?
Right. But I
That's
remember I called up and talked to the whoever was doing the fourth grade classroom. And I was like, look, like his bladder's not going to be full in 30 minutes. Like,
right.
you know, wait 2 hours. And then if he doesn't go to the bathroom at the 2 hour mark, then you can
Yeah,
start taking him every 30 minutes. Right. But like, you
yeah,
don't. So that was the conversation I had with them. But it's just, I
yeah,
think about that and I'm like, if I didn't know what I knew, like that's would have ended up happening.
right, and you
It
probably would have been, a little trauma,
annoyed and
yeah,
yeah.
very annoyed at the very least. So,
Yeah.
well,
Yeah.
let's talk about Unbound Pelvis. That name, I want to hear, where did it come from? What were you trying to say with it? Just tell us all about it.
Oh man, where did it come from? It's like hard to really even put that into words. It was just like in this quiet moment of a huge transition in my life.
Yeah,
And that quiet moment of stillness where you just feel in your body and you feel calm and you feel at peace, and the name just sort of like presents itself. Actually,
yeah,
like a whole brand sort of like presents itself.
yeah,
That's just kind of the way my brain works. It like stews and stews and stews. And then once it
yep,
clicks. And then I
yep,
go. And so like I just like remember getting it down on paper and just sort of like letting it sit there,
yeah,
just thinking like, "Oh, I'll come back to this if I wanna change it at some point." But yeah, it was in the midst of a lot of transition that has, kind of happened over the last year for me. And I think like, trying to think like how to sort of I went into right, so was in the insurance model, right?
Yeah.
And when I was in the insurance model, I was in a leadership roles, for many years, right? And so I left that setting because it was not serving me anymore. I think I had mentioned to you at one point, it's kind of like you get into this profession to help people, and then you sort of get to this point where you're like, you show
Okay.
up at work and you're like, am I going to help them or am I going to help myself?
Yep.
Right. And so you have this internal conflict every single day when you go to work, and
Yep.
you're being swallowed alive,
Yep.
and you know that they're not getting the best care that they can
You got
get,
it.
which is very not in line with me and the way I show up in the world and my
Yep.
values. And so it was this
Yeah.
creating this big internal conflict. And so I made the transition to the cash base model, and I independently contracted with a couple brands and started utilizing those skills that I had learned in my leadership roles in those next two roles, right?
Mhm.
And then started a business here in Columbus with Missy Gallo. So that's Masama. And we started that in 2024, I want to say, amidst a huge transition in her life, right?
Uh-huh.
And so we decided to give it a go. Amongst that transition, I have little humans who are getting diagnosed with, autism, ADHD. My younger one, they were throwing the ODD diagnosis, so oppositional defiance disorder, and we ended up going on to get an autism diagnosis for him. And so I'm sort of navigating all of this personal stuff around my kids and their brains and their wiring and their neurodivergence. And then the next thing you know, my husband's getting diagnosed with ADHD, and then I'm getting diagnosed with ADHD. And it's like,
It's all coming together.
as we're
Yeah.
like learning through them, we're like learning about ourselves.
Yeah.
And, our kids were really, really struggling in the traditional academic setting. We were working with the schools and doing a lot of advocating for them amidst like us learning about ourselves and looking at our past and going, wait a second, that wasn't me, right? Like I wasn't too much, like I wasn't too intense.
Yeah.
I was good enough. You know what I mean? Just like taking
Yeah.
off the mask and all of the things and being able to put language to your experience of like, I feel different, but
Mhm.
I don't know why I feel different,
Mhm.
And now you're like, "Oh, I know why I feel different," right? So
Yeah.
it's really so amongst that and amongst this transition with my little humans, I think I just kind of got to this point in this like breakdown moment of my littlest human in a complete school refusal, could not go to school, just totally burnt out. And again, in that quiet little moment where you're just like in your body and you're feeling at peace, and you just kind of look at the situation and you're like, I gotta change something. We have to do
Yeah.
something different here because like what's going on right now is not quite working.
Yep.
Uh,
Yep.
and I think I also had this realization that, the business was so meaningful to me, and I was so like to be able to be a part of that was so amazing and fulfilling, giving me a lot of meaning and purpose.
Mhm.
But I just don't think it was quite my vision,
Yep.
right? Somehow
Yeah.
I got pulled into this thing and it just wasn't quite my vision. And then here we are having a complete breakdown in our family.
Yeah.
Those moments that are just like, okay,
It's
we're
time to
gonna
pivot.
it's time. Yeah, we got to pivot, right? So that was in April, and made the decision to kind of transition away from Masama and pull our kids out of school to homeschool them. So in August, I left Masama and we started homeschooling as well later that month. And it's just sort of been this like slow unraveling of coming back to self and figuring out what's my vision? Who am
Mhm.
I? Right.
Yeah.
what's my
Yeah.
journey? What, you know what I mean? And so it feels
Yes.
like it's
This is
been
the
this,
midlife transition.
yeah, and amongst all of that too, right? Like,
Yeah.
I mean, I didn't even mention that, but it's like amongst all of that as well, right? I mean,
Yep.
I'm not quite 42. I will be soon,
Yeah.
but probably like right around 39 and 40, right? I started to have all these changes with my cycles, night sweats, brain fog. That was so bad, and so again, trying to go get help for that, which I think I kind of started to get help for that when I was like probably like 35 or 36,
Mhm.
and sort of getting
Yep.
dismissed in that way as well.
Yeah.
Because like, oh, well, you're too young, right? Like you're too
Right.
young to
Yep.
have
Yeah. And you're like,
symptoms. Yeah, and so you can just throw all of that into the
yeah.
last, like, 2 or 3 years of my life. But, luckily, a lot of that is stable now. I've got my hormone therapy regimen, I got my testosterone and my vaginal estrogen, and all that stuff is really helping me from that standpoint. And so, yeah, like you said, I think this is just that slow unraveling where you start to, like, put down all the roles that you once had because you had them to survive, and you're like, oh wait, I don't need that one anymore,
Yep.
and I don't need this one anymore. And so I kind of feel like that's the journey that I've been on in the last few years. So yeah, that unbound pelvis is kind of like that reclamation, the
Yeah.
liberation. It's like taking these struggles, these challenges that I've had in my journey, which had an impact on me, but making the choice to also take those things and bring them forward and be a part of this larger collective of individuals who are doing things differently and changing the game and standing up and saying, like, enough is enough, right?
Yeah.
People deserve
Exactly.
better. People deserve more. And so that's kind of, I guess, the story behind the name for Unbound Pelvis.
That's amazing. And so this is your coaching for clinicians, or is this the physical
This is a
therapy aspect,
yeah, this
right?
is a clinical brand.
Like
Yep.
that's your clinical brand.
Yep, that's the
Yeah.
clinical brand,
So
which I'm
women with
not
like postpartum perimenopause sexual health, musculoskeletal concerns,
yep,
whatever.
yep, pelvic yeah, pelvic health,
Yeah.
orthopedic pelvic floor, perinatal. But I think too, like, you could throw a little, neurodivergence and trauma and nervous system informed in there as
Yeah.
well, which, I thought as a PT, like, maybe I sort of knew the nervous system, but, like, I don't think I really knew the nervous system until this kind of journey with my boys and learning
Yeah.
how influential the nervous system is, to just, like, our day-to-day function.
Yeah. I think it's amazing when you start
It's
thinking about that stuff. Like it really is.
Yeah, and even, like, my own experience, right? Like, I think in April was when my son had his, like, school refusal, but in January, I had kinda this old neck shoulder pain that sort of, like, flared up on me. Like, it was an old thing that would come and go intermittently, but it was, like, the worst it had ever been in January, right? And so, it was my body speaking
Yeah.
to me, right?
Yep.
And
Yep.
telling me, like, "Enough is
Discuss.
enough, like, you
Yeah.
can't keep going, like, there's something that has to change." And so but that's all kind of rooted in the nervous system. The
Mhm.
nervous system that I developed as a very young child. Thank you, nervous system,
Yep. Where we
for
hope
helping
all.
me survive, right? Like that very primal part of your brain. So it served a purpose. But again, at this stage of my life, like, I don't need that wiring
Right.
anymore,
That's
right?
right.
It doesn't
That's right.
necessarily serve me.
Yep.
Um, and, and as you create enough safety with your support system, those things are going to start to come out, right? As you sort of like finally have the chance to process them and have the chance to rewire your nervous system, right? The neuroplasticity. So I think, there is that whole new aspect that I feel like I'm kind of birthing into this practice that I don't think I
Cool.
quite, it didn't click. So this is the second click for
Yeah.
me, right? And I'm excited. I did some myofascial training and I've been doing a lot
Awesome.
on myself, and that's been super, super helpful. And so I'm really excited when I start treating again to be able to kind of birth some of this new stuff into the individuals that I'll be treating.
Yeah, that's
Yeah.
amazing. And so have you officially opened up yet? Are you
No, not
okay,
yet. No.
okay. So
But
for
what
those
I did
yeah,
open was Root and Rise
yes,
Consulting.
tell us
Yeah.
about that.
Yeah. So Root and Rise Consulting, um, I guess I started that in November. I didn't actually
Right,
start working with any clients until January, but I kind of like started putting it out there in the website and the brand. And so essentially, Root and Rise Consulting is focused on helping overwhelmed visionaries, particularly women in healthcare, um, and helping them to learn that back end of the business, the structure, the foundations, the systems, the financial clarity so that they can move from or take their big visions and bring them to life in an aligned way that works for them and their values and their life, right? I say this a lot. I kind of like the analogy that I give is like you can take the girl out of what is it? Like you can take the girl out of the country, but you can't take the country out of the girl, right? Like you can
yep,
take the human out of the system, but you
yes,
can't take the system out of the human unless you slow down. You start thinking about your thinking. You start learning those patterns that live underneath of you that drive behavior.
yes,
Um, and urgency culture and pressure and just so many things that kind of spend a lot of us like sort of spiraling in the
yeah,
wrong ways and in the wrong places, and then we're like, why am I not making progress here? And I left the system for a
yeah,
different life, right? And you
yeah,
might have something different over here, but until you work on some of the underlying components, you still have the system that lives inside of you,
yeah,
right?
absolutely.
So I think that that's like a big component of Root and Rise consulting, but it is also about like sort of taking my experience in my leadership roles and being able to, build a successful business here in Columbus. And, I have really learned um, how I process the world, which is through details and patterns and pattern recognitions, and I'm just very perceptive, and I feel like I can see 17 steps ahead when I don't even wanna see 17 steps ahead, but
Yeah,
I just, like it's just sort of this internal framework that I've, developed through the years, through my lived experience, and I think the way that I think, um, and the way that I process the world, and it lends itself to, like, really being helpful to build out some of the structure, the systems, the logistics, the operations, the financial components, and really collecting the data so you know where you're spending your time so that you're
mhm,
actually getting the changes that you want to get with your business. So
it's
you run your business instead of it running you.
yeah, because it's easy for it to do
Yeah.
that,
And
actually.
taking the automatic that happens in your head and all the things that
Mhm,
you carry, and actually being able to, like, understand that and putting it out there, because as long as it lives here and it's not out there in a system,
yep,
you're like a hamster wheel a little bit
right.
kind of spinning.
Right, right, and just teaching people to how to, allow things to happen and not to change too many things too quickly
Yeah, like, you
and to
gotta
give things
organize
time,
it. Yeah.
right? So you have to organize it, allow something to happen before you say, "Okay, now we do have to change it," because that's can be so hard in business to allow something to work, but to give it
Yeah.
the time to work and to be patient enough for it to work
Right.
before you
Right,
change
because
it,
you might be
right?
like, "Oh my god, we gotta do this thing," and
Yeah.
then,
No
like,
one's calling.
"No,
No
that's
one's
not
coming in.
working. We gotta do this thing."
Yeah, it's hard because you get in your head and you're just like, "Oh my gosh." It's sometimes and it's hard to step back and be like, "Okay, this is only a year old, this business, and
Mhm.
that's pretty dang good, and we're just gonna allow it to continue to grow." Because I think we just see everybody else's steps that may be 2, 3, 4, 5 years ahead, and we compare ourselves
Compare.
to that. I mean, it's hard not to do,
Mhm.
and it's a constant, I think, just re-talking to yourself like, "Nope, this person has been doing this for 5 years, for 10 years. This is not their 1 year."
Right. Well, yeah, and I think, like, if you probably went and talked to that person that's there for 5 or 10 years, like, and you asked them, "Well, where were you at a year?" Right?
Yes.
You know what I mean? They wouldn't they would
That's the question
probably
you have to ask, not where are
mirror
you
back.
now?
Yeah. They would
Yes.
probably mirror back to you, like, all the struggles that you're having,
Yes.
right?
Yes, I
Mm,
agree, and that's sometimes I think where social media can get, when you're a business owner and you're watching everybody else too, that can really be a struggle. You have to be really careful with that, and sometimes it does need to be part of your business. For mine, it certainly does because it's, a telemedicine practice.
yeah.
So, those that are building their practices, whether it be their brand or practice through telemed or social media, those are big things you have to be mindful of
Yeah.
too. Well, you didn't see the 500 edits. You didn't see the team that might be behind them doing all those things too. I think women need support and need mentors and coaches that know what it's like and that can steer them in the right direction and not take advantage of them because it's hard, and if you don't have a support system to be a business owner, an entrepreneur, it's hard, there's no doubt.
Yeah. I mean, yeah, I think when you live in your head, right, like, you need an external person to help you see the things that you don't see because, like, you're in it, right?
Yep,
And again, if you've never been on the journey, like, you don't know what you don't know, and so, like, you
right.
can really learn from individuals who have been there. Yeah, so I'm a huge fan of, I mean, when we were at Masama, we had coaches and people that
So important.
we
It's
invested
so
in to
important.
help us.
Yes, help your business grow, help some of the operations that you don't know. It's such a team if you can do that. And sometimes it's hard when you're a small business. You really have to pick and choose what you can invest in
Yep.
at whatever time you can invest in that, right?
Mhm.
But sometimes you
Yes.
have to kind of put the aces in their places and,
Yeah.
someone or
Yes.
something to help. You just have to,
Yeah.
in order to grow. Sometimes the next
Right.
step, like you can't grow without investing in someone or
Right.
something to help. Yeah.
Right, and so it's like, how do you know when to do that, and how do you
How do you pick the right
financially,
thing?
like, how do you like,
Yeah.
and what yeah, how are you
How do you
gonna
navigate it?
structure that, and, like,
Yep.
what risk are you willing
Yes.
to assume, and
Yes.
which ones are
Yes.
you not, and are you gonna get funding to help support this or not? Like, it's so,
Right.
and all of that stuff is very individualized from
It
person
is.
to person
Yep.
too, right? So, like,
Yep. What
you
kind of
know
ROI are you going to get on it? Are you going to get,
yeah. And if you can sort of make calculated predictions, you're at least going to be close, right? Like,
Yeah.
we can't
Yeah.
project, we can't predict the future,
Right.
right?
Right.
But we can at least understand the risks that we're assuming. And so we are managing our expectations, right? Because a lot of it is also just the expectation management.
Yeah, exactly. Because if
Mm,
you've never done it before, you don't know what 1 month looks like, and you don't know
right.
what 1 year's supposed to look like,
Yeah.
and a year and a half is supposed to look like, or how do you continue to grow, or how much do you wanna grow?
Grow. Yeah, and again, are
I
you are
mean,
you are you living the journey that you wanna live? Are you
yeah,
bringing your vision to life, or are you still operating from the old system, but in a
yeah.
new system kind of? Or,
Right, 'cause it's
you
hard to
know
break especially when you're going from employed to owning your own business and then going from insurance model to a cash-based model. It's a whole different mindset. Insurance model doesn't serve really anybody but the insurance company.
Right, right. Well, and even it's like I just talked with a client the other day, and she was, within the programs that I've sort of designed, there's like, you can pick, like, how much support you want, right? Do you
Mhm.
wanna work with a strategy call once a month or twice a month? And then I have a prep form for that call, and I
Yep,
have them specifically designed in a certain way about, like, rooting in our foundations, and like going through the rise, and then where are we going to refine the systems, but even like a section about, like, kind of getting under, like, what are the things underneath that are driving this behavior. And so, like, and then I'll do weekly check-ins, which is also like a design form that they kind of fill out as well. And so with that form, like, she was like, well, I'm really noticing that the way that I've kind of structured my model is just totally based on, because she does work with insurance.
yeah,
And she's like, I've totally designed the structure so that it works for the insurance, right? But it's like not working for
right,
her, right?
right.
But it was like kind of like, oh yeah, I'm gonna get this reimbursement from the insurance company, but I'll have this extra long appointment, right? And I'm
Yeah,
like, well, that helps. It does help your patient, because because they get extra time with you and they get to
Sure.
utilize their insurance, but now
But
you're
you don't.
running yourself ragged here
That's right.
and you
And you're
don't
not
have
getting
any. Right. She's like, "I
anything
feel like
for
I'm
that.
working all the time and I, like, have nothing to show for it." And I was like,
You
"Yeah, I
are.
understand why you feel that way.
Yes.
It is very valid to feel that
Yes.
way."
Absolutely.
But it was sort of that aha moment where she
But
was
sometimes you
like,
have to have that aha moment,
yeah,
don't you? You're just like, "Oh, okay."
"Whoops." Yeah.
My
Right, so
god.
we kind of were talking about, like,
Yeah.
restructuring that, but even just, like, little things, right? Like, she was, really struggling transitioning home, and so, like,
Yeah.
getting like, understanding what's happening behind the scenes, but then, and then being able to, because once you can hear it and name it, then you
Yep.
can start to, like, look through and figure out what the needs are, and then you start to throw in the business components. Okay, like, we
Yep.
need a system here, we need some structure there. How are we gonna design this to fit you? And so that's, like, the other kind of component that sort of comes into the consulting is, like, actually, like, helping individuals with figuring out what those solutions are, diagnosing the problems, providing recommendations, helping to build frameworks with them, and sort of like creating those plans of implementation and organization and prioritization, and sort of like putting that whole thing together and then being able to sort of stage it so that you can go from overwhelmed to
Yeah.
aligned and also have, again, like staged in a way that also is going to support whatever your financial situation is as well. But not consulting in the sense where I'm like, I'm doing it for you, right? It's
Right.
like, I'm on this journey with you. Like,
Right.
we're solving together.
Yep.
But it's not just like coaching. I went back and forth on the name and I was like, coaching, consulting. I like kind of went back and forth and I was like, well, yes, we have this coaching aspect of like thinking better,
Yeah.
seeing differently, awareness, decision making, but then also jumping in and helping with diagnosing problems and then
Yeah.
helping to like be a solution finder for those problems and sort of build the system with them. So I really made this very not like a group kind of situation, very one-on-one, very individualized. I'm sort of a pretty in-depth person, and so I also, like superficial doesn't really work for me, and
Mhm.
so it's aligned with
Mhm.
me as well, which is why one of the
That's
reasons why I
awesome.
sort of set it up that way. Yeah.
That's awesome. Well, tell everyone where they can find you. Like, right now, they can find you for the consulting now. What's the best way for them to find you and work with you?
Yeah, I mean, you can connect with me through Instagram or Facebook. That's root underscore rise underscore refine is the name. And then my website, which is root n, like the letter n, riseconsulting.com. And that would be another way to also there's like a contact form that you can fill out there to connect with me. And we could set up like a free discovery call of some sort to sort of, go through
Yeah. If
go
you're
through
aligned
and each
together.
individual's, yep. Yeah. And it is really geared towards women in healthcare. So, like,
Yeah.
while my background is in physical therapy and pelvic floor physical therapy, I'm working with a lactation consultant right now. And so,
Awesome.
like, anybody that's sort of,
So any clinician like, in healthcare or anyone in healthcare.
yeah, women
Yeah.
healthcare, particularly like small business, like just going to get started, or they're a solopreneur and they need a little help, like refining their own systems, and then maybe even some help to scale a little bit to help support
Yep.
them. Maybe they're having some patterns that they're stuck in. They're having trouble keeping staff.
That's awesome. And then you're opening Unbound Pelvis. Do you have a projection on when
I
that's
do.
going to start?
I have my website up.
Okay. So they'll be able to go to
That's
that. Great.
unboundpelvis.com.
Okay.
And then I have Facebook and Instagram as well. So that's
Okay.
the unbound underscore pelvis. So you can check that stuff out there. And then in terms of like when I'm going to be treating, I don't have anything completely set in stone yet. So to be determined on that.
Okay. Do you have to watch social to find out?
Yeah.
Oh, that's awesome. Well, thank you so much for spending this time, and the journey has just been amazing, and it's so exciting to see what in what you're doing now and how you made this transition and, what your future is and the new business opening up here pretty soon. So, and just the time in general to take to talk with us. That's fantastic. I appreciate it.
Thanks for having me. I enjoyed it.
That's a wrap on today's Founders Series. You can find Dr. Manna and explore both Unbound Pelvis and Root and Rise Consulting through the links in the show notes. All right, all. If this conversation resonated with you, take a moment to share it with someone who needs to hear it, whether it be a colleague, a student, a woman ready to think differently about her health and her future. If you're watching on YouTube, please make sure to follow, like, and subscribe. It's the easiest way to support this work and helps this content reach more people, more women who need it. If you're listening on Apple Podcasts, please follow the show and leave a review. Those reviews matter more than you realize and help other listeners find the series. You can also follow me across platforms for more education on all the social, Instagram, Facebook, YouTube, LinkedIn, for more education, clinical insights, and founders content. For clinicians, you can earn CME if you listen to this on the Pinnacle app. And if you want to learn more about how we approach midlife care, hormone optimization, metabolic health, you can find me at Osteopathic Midlife Health. So as always, this series exists to help you think differently about your body, your career, and your future. Because the next decades of your life deserve intention, strengths, and clarity. So thanks for being here, and I'll see you next time on the Founder Series.